My name is Sean King, and I did my EXS 499 clinical internship at the Southern Maine Healthcare Cardiopulmonary Wellness Center, located at 1 Medical Center Drive in Biddeford, Maine, zip code 04005. The commute time from the UNE Biddeford campus at 11 Hills Beach Road to the Cardiopulmonary Wellness Center is about a 14-minute drive with no tolls or highway driving required. The internship site supervisor at SMHC is Tom Delmolin Jr., who is a clinical exercise physiologist. He can be reached by phone at 207-283-7787 or by email at tjdelmolin@smhc.org. Tom is also a UNE graduate from the Applied Exercise Science program. At the Wellness Center, a variety of healthcare professionals, including the exercise physiologist, an exercise technician, and 2 to 3 registered nurses, work together with cardiac and pulmonary patients to improve their exercise capacity and promote healthy lifestyle modifications. On Monday, Wednesday, and Friday, there are 4 classes offered for mostly cardiac patients with some pulmonary patients. These classes are at 7 a.m., 8:45 a.m., 10:30 a.m., and 1 p.m. Additionally, on Tuesdays and Thursdays, there are classes for mostly pulmonary patients. The equipment within the facility includes 4 treadmills, 3 recumbent bikes, 2 stationary bikes, 2 ellipticals, 2 new step machines, a Concept 2 rower, 2 cable machines, a set of dumbbells, kettlebells, stability balls, medicine balls, and other miscellaneous gym equipment. Intern duties include assisting in the cardiac and pulmonary rehabilitation process, which starts with mostly observation to understand how the classes are organized and ran. This includes exercise progression for patients as they continue in their program, explaining to patients how to use the exercise equipment and their upper limits for exercise. Additionally, data is recorded from their exercise session into a computer, including their heart rate, blood pressure, blood glucose, RPE, MET level, and for pulmonary patients, dyspnea, and their oxygen saturation. An ECG monitor is placed on each patient for the entire exercise session, which is recorded into the computer. All of this information is then printed and added to each patient's file, where their MET minutes are calculated to track their progress throughout the rehabilitation process. As you gain more experience and confidence, you begin to work more independently with patients, including answering questions about exercises, explaining and demonstrating strength, balance, and stretching movements, in addition to taking resting blood pressure measurements and progressing over the semester to take an exercise blood pressure. In my opinion, a strength of the internship site would be the hands-on experience even from the start when you are not directly working with patients. Learning the computer programs, understanding patient charts, and collaborating with the exercise physiologist for exercise progressions before classes are just some of the things that you do before working with patients. Something to take in consideration if you're thinking about this internship site is the hours of operation. As the first class starts at 7 a.m., I usually arrive to the hospital around 6 a.m. With their last class starting at 1 p.m., the facility is closed around 3:30 in the afternoon.